This punctuality is truly pharma punctuality. Thank you very much, all of you. Almost 1,000 attendees are already there. Thank you very much. Please welcome everybody. A special warm welcome to all the dignitaries of this webinar, including Mr. Yavagal, sir, President of Karnataka State Pharmacy Council. Sir, you look very dashing, you look very handsome, and you look like a tycoon. Thank you very much for coming, sir. Great. I also extend a very warm welcome to the technical speaker number one, Dr. Gayathri, madam, a well-known name in pharma education as well as in the pharmacist community. Your gracious and I should say technical presence is indeed a great morale booster for all of us pharmacists. Madam, please, warm welcome to you. I also extend a very warm welcome to the gentleman, I should say officer and a gentleman, and that is Mr. Samson, sir, always a genuine help to all pharmacists, ever smiling, and he is always there for us to take care of our needs. As the Deputy Registrar, he is doing excellent help and service to pharma community. Thank you very much, sir, for coming. I extend a very warm welcome to Mr. Manoj Kumar Yadava. Manoj is one of the dapper young pharmacists who is always, looking at the next level. He is our technical guy, and he is always happy to lend his technical support to Karnataka State Pharmacy Council. Very, very warm welcome to the President of KDPMA, none other than Mr. Sunil Attawar, sir. Very warm welcome, sir. Thank you very much for gracing this occasion by your presence. This webinar's stature has increased manifold. Thank you very much. And warm welcome to each and every attendee. Now, how many have we hit already? I think, oh wow, it is good. 1,185 attendees. Super. So today, as we are aware, the topic shall be importance of knowledge updation for community and hospital pharmacists. So in this importance of knowledge updation, there are very good technical speakers who will lend their interesting insights on how you can provide a better service in these COVID-19 times, and generally also both not only as a pharmacist but also as a person who is a counselor. In the meantime, being the co-speaker, I will also represent some of my viewpoints with the help of these slides. Friends, this is a special webinar of the pharmacist, by the pharmacist, and for the pharmacist. And today, all of us pharmacist corona warriors are challenged by one of the most mysterious illnesses that is dogging our society. It all started with this Wuhan wildlife wet market. This is a strange market. There are lots of wildlife materials and living beings which are sold for meat and food. It starts with the bat, then you have even a bear if you wish. There are so many unusual tastes in this world. Well, this wildlife wet market is the origin of today's COVID-19 crisis. The bat is a very unusual flying mammal. Now, in this bat, it is estimated to have around 1,500 pathogens, viruses, which are dangerous to humanity also. Now, this bat has a very unusual immunity. It does not get infected by the virus because its immune system can take care of it, but it can transmit the virus to other animals. And if the human being is in intimate contact or consumes that animal, then he gets that virus. That's exactly how the MERS came into the society, human society. Middle Eastern respiratory syndrome probably came from the bat to the Arabian camel. Similarly, there are strange tastes. People even consume this civet cat as a food, and probably that was the conduit for SARS-CoV-1 virus. And as far as this concerned, SARS-CoV-2 virus is concerned, from the bat, it is speculated or hypothesized that the transmission of the virus has taken to the pangolin, and from pangolin to the human habitat. So pangolin is not only liked for its meat, but also for its scales. So probably patient zero was a butcher at the Wuhan wildlife market. So this virus, which is having a crown of spike proteins, that is why it's called coronavirus. It's like a crown, corona. So this virus, this invisible enemy, is the most transmissible, contagious, and virulent virus probably humanity has ever seen. And this not only goes through the respiratory droplets, but also through the salivary droplets. Now, that's a very important point because this virus is found in the saliva also. And consequently, there is a very fast transmission of this virus. People say that you should maintain 3 feet distance, physical distancing. But now people are saying it should go up to 6 feet distancing. Reason is transmission of the virus is taking place very fast. And it's a very, very unusual type of a speedy transmission that's taking place. So the pharmacist in this case is playing a key role in helping flattening the curve, not only by helping people, the government to follow the lockdown, but the pharmacist is also educating and counseling people about this disease. He acts as a very important health educator in the societal system. Now, this disease, as is well known, spreads through respiratory droplets, not only when a person coughs, but also sneezes and even exhales. That is a very important point as per WHO. And the transmission of the virus is also known to take place through salivary droplets even when he speaks. So if the infected person speaks too, there is a transmission of the virus to the environment, and it's possible that inhalation or that virus will go to the next person. That is why this has become a very dangerous virus. Of course, by now all of us are aware there are symptomatic carriers and asymptomatic. Around 67% of them will be asymptomatic carriers. However, these asymptomatic carriers, within 8 days, they would have transmitted the virus to maybe 100 or 1,000 people, depending on how many asymptomatic carriers were there. So it is important for us to maintain physical distancing and avoid roaming around unnecessarily unless there is a specific assignment given to us. Normally, among the symptomatic carriers, the first symptoms which are seen is tiredness or fatigue. Next, dry cough. And third is fever. These are the normal symptoms. But if it exceeds, probably by the 8th day or the 10th day, breathing difficulty will start. That is when it is almost confirmed that this is a COVID-19 case. This breathing difficulty indicates lung involvement, lung collapse. So vulnerable subjects like diabetes, smokers, liver disease patients, they are all having this problem. Sometimes diarrhea and muscles and ache, muscle pains can also be there. In the persons who have died due to the COVID, they have found an unusual presentation in the lungs, and that is this ground glass effect. So as if the glass is broken, that effect is seen. It is also unusual presentation, a dermatological symptom which has come to the fore recently is the burning pain in the reddish toes. So that is called as COVID toes. This is another symptom. This is a very interesting case. Dr. Yi in Wuhan, look at him, how fair he was. After he got this, he contracted the viral infection because of probably the treatment which causes lot of hepatotoxicity. Just see how he has become totally dark. That is the frightening dimension of this disease. This disease, when they are treating it, it causes significant morbidity and even mortality. The same case with Dr. Who. Over a 99 days treatment, he became from a fair-skinned person to a totally dark individual, probably due to hepatic involvement. So another interesting sign and symptom that's come as new today is that there is anosmia and hyposmia and loss of taste. Loss of smell, loss of taste. Both these are also seen. Hence, the government and all healthcare practitioners across the world are saying a global lockdown, physical distancing is important. Now, along with this physical distancing, corona warriors like this Lakshmi, Miss Lakshmi, the pharmacist, hypothetical case. She is now going for work. When she goes for work today, she doesn't use the public transport. She goes via the private transport. She carries the mask. In her handbag, she has a number of these hand sanitizers. She frequently uses it. Inside the shop, she uses the face shield and also uses the gloves. So that's the change which the pharmacist should bring in, only because of the fact that now the COVID-19 threat is coming to them. And she always jokes, Lakshmi, the pharmacist, jokes and says, "Stop touching men." What she meant is, don't touch the mouth, eyes, and nose, because contamination from the hands can go to these areas, and from there it will enter into the body. Hence, it is recommended you please use your non-dominant hand. Like if you are a right-handed person, then touch the contact surfaces like the shelf of the chemist shop with your left hand. If you are left-handed person, then use your right hand. Reason is, we always touch our face with our regular hand. So the contamination from hand to mouth or nose or eyes will be reduced. Remember, the various studies have indicated we involuntarily, by force of habit, touch the face 16 to 23 times an hour. Nowadays, they are not allowing the patient to come inside the shop. Very correct. The patient has to purchase the medication by physical distancing from outside the shop itself. So ensure that. Remember, there is also a danger of the ceiling fan and AC. It will circulate. It has been established. The virus can circulate in the room. So if an infected patient comes in, then probably his respiratory droplets, which are microscopic, will start circulating in the entire room of your pharmacy. So please take care not to allow the patient to purchaser to come in. Most important is the technique of this hand washing. Please wash for about 40 to 60 seconds. Put the soap, lather well. Wash the front of the hand, back of the hand, in between the fingers, the thumb, and the nails. This is the WHO formula, so I am just reiterating it. If you are using a hand sanitizer, which you should do in your shop after every 2-3 patients, preferably you have gloves. Then every 2-3 patients, you please put the hand sanitizer, 1 rupee coin, around that much amount, rub your hands, then afterwards rub the back in between the fingers. That is how you should use the hand sanitizer. It's very important. Your safety is paramount. If you are not safe, your family becomes unsafe. Carry a pocket sanitizer. When you leave your home, wear the mouth mask. Insist the patient should wear the mouth mask. Wear the gloves and use the sanitizer after every 2-3 patients. Don't take the currency notes. If you are taking currency notes, keep it in a box for about 12 hours, 14 hours. Or put some sanitizer on your hand, rub it, keep the currency note in between, rub it lightly, and then use it. Preference to be given for digital payments. And when you are taking stock from the salesman, that is the stockist sales boy, take it and leave it aside for some time. I know he is your friend, but don't have intimate contact with the stockist sales boy. Maintain physical distancing. This is very crucial for you, for your safety. Rearrange the items only after some time. Remember, it is established that when you talk, you spray around 2.5 microscopic saliva droplets per word, which I am also doing. Hence, it is useful to use the mouth mask both by you and the patient. Please ensure to use this and strictly enforce it. Saliva droplets are also an enemy, and they may also be carriers of COVID-19. Remember the fundamental law of protection. This our friend Dr. Khalid Khan shared with me. So consider everybody around you as a symptomatic carrier of COVID-19 and that he is capable of infecting you. For instance, what are all the issues that may crop up? Now, Lakshmi, the pharmacist, she got a thyroid disease patient. So while conversing with her, the thyroid disease patient said that she is not getting good thyroid levels. Then when it was examined, she said she's taking the tablet after meals. So it was Lakshmi, the pharmacist, to counsel take before the meals, and that made the change to her. Then she called her for a brown bag consultation, which means get all your medications, whatever OTC products also you're using, and then examine. When she examined this case, she found the patient was taking 3 analgesics, one for knee pain, one for headache, not knowing that they are all for the same purpose. So different brands containing 3 analgesics causes nephrotoxicity. So she educated that patient through brown bag consultation not to take. These are all the dimensions of our duties, and that is important because knowledge is what's going to empower us to give a better counseling. And along with this, due to the counseling, this pharmacist Lakshmi was able to recommend vitamin C, zinc, selenium supplements, curcumin supplement, hand hygiene. She requested her to buy hand sanitizer, oral hygiene products, mouthwashes, throat gargles like fresh flour was also encouraged by her. So she got extra sales. So that is intelligence of Lakshmi the pharmacist. Not only is she educator, but also helping to improve the sales of her pharmacy. Another secret ingredient she had. Please notice this smile. Out of these smiles, there are 2 types. One is the false and the other is the Duchenne true smile. The Duchenne smile, which is involuntary and genuine, was examined in the students of all the subjects in the Mills College. And then they found the genuine smilers had better life in terms of marriage, well-being and career. So your smile should reach the eyes. So that is what is called as a Duchenne smile. Not like this pretty female. She is giving a fake smile. So don't get enticed by her. I am giving you a seductive smile. And I am saying, you are well dressed for the day only when you wear a smile. So please, ladies and gentlemen, wear a smile, have good education, do counseling, and do good trading. So this is my message for the pharmacist. And now I request the most handsome person here in our entire team, and that is our Gangadhar Yavagal sir, the president, dynamic. Actually, chronologically, he looks older, but if you look at him, when he speaks, when you interact with him, he is the youngest, the most zealous person. He is both an engineer and a pharmacist. He has been the secretary of KSPC and active in AOCD, and he has many feathers in his cap. He was responsible for several ventures of KSPC. In this regard, I would also like to say that Dr. Shivanand sir, Professor Shivananda sir also, who is his able deputy, both are doing a fantastic job. Shivananda sir is not here with us, but I recollect him and respect him also. Over to you. Yavagal sir, please continue.
Hello.
Yes, sir. Please continue.
My dear pharmacists, Karnataka State Pharmacy Council has had the reputation of initiating many programs for the benefit of its pharmacists. We have again taken this initiative to provide some information to the pharmacists who are working at par with other healthcare professionals during this pandemic. This is the first of its kind series of such seasons that will be conducted in future also. Today's webinar will be presented by expert pharmacists who have carved a niche for themselves in their chosen areas. Mr. Sunil Chiplankar will moderate the webinar. Dr. Gayathri Devi will provide general awareness, do's and don'ts to be followed by pharmacists. During this situation, since although there is some relaxation by the government, pandemic is still on. Mr. Sampson will touch upon advice to be provided to special population of patents in a bid to safeguard their health in this fragile situation. Mr. Manoj Kumar will take pharmacists through technology updates for them to be equipped with so that life goes on in spite of the pandemic. And of course, there will be concluding remarks by Mr. Sunil Attawar, President, Karnataka Drug and Pharmaceuticals Manufacturer Association. You can hope for an interesting and informative session. Please stay tuned in throughout. Thank you.
Thank you very, very much, Yavagal sir. That was really inspiring, and your voice has so much of strength. It galvanizes us into action.
Thank
Thank
you.
you very much
Thank
indeed. The next speaker, without much ado, I will go to her, and that is none other than whom we have been waiting for, Dr. Gayathri Madam. She has 30 years of experience in teaching, administration, learning, and development. And the best of all, like a good pharmacist, she has an excellent smile. And along with her distinguished academic record, in which she has been the HOD and also a dean with the Manipal group, she was handling 3 lakh students in the Sikkim Manipal University. And she is an able speaker. She has talked in so many forums and she has captivated the audience. So, Dr. Gayathri Madam, we are all ears. Please.
Thank you, sir. Thank you so much. I hope you can hear me.
Yes, loud and
Yes.
clear, ma'am.
Yes, thank you. Good afternoon, everyone. It's a pleasure to be with all of you today. It's heartening to note that there are so many attendees. There's such great enthusiasm and there are so many attendees. So the topic for today's webinar is, you're all aware, importance of updated knowledge for community pharmacists. Isn't the topic so apt? It's apt, whatever is the time of the year, but more so now in the current scenario, right? Hats off to Mr. Sunil Chiplanka for choosing this topic. I readily accepted to participate in this webinar since I found it so relevant. So what we'll cover in today's session is this importance of updated knowledge. As pharmacists, what we commonly face is that many of your family members, relatives, and friends believe that you know everything about healthcare. Am I right? Are you able to relate to what I'm saying? You've been approached by many asking what medication he or she should take since he or she is facing some health problem, right? It's okay for someone to ask us about medication because they believe that we know everything about medication, and rightly so. We are proud to be pharmacists. Our forte lies in our knowledge about medicines. While that's true, we should also know our limits. While many of our friends expect us to diagnose and suggest treatment with names of drugs to consume so that he or she can get relief from whatever problem he's facing, we cannot overstep and do that, right? Why so? Our job as a pharmacist is to provide information to patients regarding drugs that are prescribed by a doctor, not for us to prescribe. So we can give information regarding its usage, precautions, if any, duration or frequency of dosing, what to avoid, what to be wary about, what to do in case of any untoward event, and so on. Remember that pharmacist oath that all of us have taken? Yes, we need to abide by that. Okay, if that's about where we draw a line, should we not be thinking about how we can help our community through our duties as a pharmacist? As all of you are aware, most individuals command respect in this world because of their knowledge. Our ancestors have rightly communicated to us through generations that knowledge is the biggest asset that one can possess, which cannot even be stolen, unlike material wealth. Considering that all of us possess knowledge, what do we do about it? And particularly in today's scenario. Since there's no cure for COVID-19 as of now, and there's no vaccine either, and worse still, with fake news and all kinds of treatments flying all around a cure for COVID-19, and that too by non-healthcare professionals, there's utter confusion prevalent among public and patient community. Since they are confused and doctors are difficult to approach, with most hospitals still being shut or involved in only emergency care, pharmacist is probably the only healthcare professional who's available for consultation. Did you see? I used inverted commas for consultation. Well, they found some savior who can answer their myriad questions that's bothering them, isn't it? And that's where we come in as saviors to provide them with the right information to allay their fears, deviate them from any wrong approach being taken, and guide them towards a healthy track. As you've already attended several webinars organized by Karnataka Registered Pharmacists Association in collaboration with Group Pharmaceuticals, you're aware of the hand washing technique. Mr. Kaushik demonstrated that during one of the webinars. Mr. Sunil demonstrated it today, right? You're also aware of maintaining social distance, hygiene to be maintained, and the usual precautions like men that he mentioned today. While there is information overload and constant repetition of the same information, your role as a pharmacist comes in handy to provide what? Drug specific or specific drug related information to patients. Patient counseling is part and parcel of pharmacist's role, particularly in a community setting. Since there's lockdown prevalent in several districts even now, there's restricted movement and fewer people visiting pharmacies. As a community pharmacist, since you also play the role of a neighborhood pharmacist, you're most likely aware of the family background of several patients or their attendants who visit you. This is the time when you can give them the most valuable advice. Fine. Are you equipped to give this advice? Let's dwell upon just a few of them today. First thing is to answer only those questions for which you have authentic information. I repeat, authentic information. And how do we identify authenticity? Because Sam told me and he's my trusted friend. Because I think Manoj is very knowledgeable and I heard it from him. No, sir. No, ma'am. It's only from government sites. Whatever are the government notifications being released, you're aware there are bulletins being released in the morning and evening. Follow only those. Notifications regarding prohibitory orders, regarding classification of areas into red, green, and orange zones, and restrictions in force in each of these areas may be taken note of and communicated to patients if they are unaware of the same or if they ask for it. Okay. You may be wondering, is it our duty as pharmacists to provide this information regarding zones, regarding restrictions? Yes, like I mentioned, only if asked. Because if they are ignorant and they do not follow guidelines or restrictions, they will end up as patients. How? Police mavanavara donnaya petrinda. Isn't it? For those of you who don't follow Kannada, I just meant that you will end up as a patient through policeman's lathi charge for violating restrictions. So if that's about local information to be followed, at the global level, please refer to WHO's publications or CDC's publications. Manoj will throw more light on that. As far as possible, please refrain from watching news related to number of cases or worse still, number of deaths due to COVID-19. The reason why we say this, are you in a position to contribute towards decline of these numbers just by not following news and not tracking those numbers? Absolutely not. Can you contribute to decline of these numbers through any other means? Yes, of course. There is a way. Yes. Just by counseling patients towards following everything to remain hygienic, healthy, and to engage in activities that boost positivity and to consume foods that improve immunity. This is also the time when most people come to you for paracetamol supplies, cough and cold medication, azithromycin, and HCQS supplies. As you're already aware, some of these are under Schedule H. Please follow ethics and be polite in denying supply of the same if there is no prescription. There are chances that some of them want to escape being quarantined if they're exhibiting symptoms by consuming these medicines. I'm sure many of them have already asked you if they can consume HCQS. Please convey to them that this drug is being used as a prophylactic, particularly for use in frontline healthcare professionals, as their exposure to viral load is very high. You can tell them that this drug has not yet been approved by FDA for use in COVID-19. Advise them not to use this medication unless their doctor has recommended them to do so. We're saying this because HCQS, prolonged QT interval leading to ventricular tachycardia, that is abnormal heartbeat. You may also provide the latest information in this area, the emergency approval of remdesivir by FDA. Since India is a part of WHO solidarity trials to combat coronavirus, India has also received 1,000 doses for trial as announced by Minister of Health and Family Welfare, Dr. Harshvardhan. There was news about 2 days ago regarding Italy being successful in developing a vaccine against COVID-19, but it still seems to be at the stage of preclinical trials. You've already received notification from Drugs Control Department to maintain a record of those individuals to whom you've dispensed medications listed by them. Please follow ethical practice in sharing this information with DCD. You'll be serving the larger community and saving many individuals from contracting infection by providing this information to DCD's office, because potential carriers can be isolated on time by doing so. Let's now see what are some of the do's and don'ts that you need to follow. Please inform patients to maintain social distance. All of us are aware, we've been following it, still continue to reinforce this advice. Sport a mask throughout the dispensing process. We are only saying throughout the dispensing process, not throughout, else you will end up with hypoxia. Dispense to only those who wear a mask. So we can at least make sure that they are following regulations, or if not regulations, the norms. Advise patients regarding use of sanitizer, frequent washing of hands, reporting to helpline number in case they are experiencing any symptoms. Advise patients not to self-medicate. We are aware that availability of doctors at this point in time is a problem, but several of them are providing teleconsultations. So you can convey to the patients who ask you about medication to approach doctors over phone. Any special population like children, pregnant women, lactating mothers, geriatric patients, please advise them regarding the right way to consume medication. It could be timing, when to consume, the frequency of dosing, what to avoid, be it drug or food, what to consume to improve bioavailability, what adverse reactions to look out for. It could be anything like, say, colored urine, or say dark stools, or abdominal pain, or dizziness. You're aware, right? You see, they're already distressed, and you can contribute towards their wellness through your word of caution. So what don'ts do you follow? Do not dispense without prescription. Paracetamol, azithromycin, HCQS, cold and cough meds in particular. Although paracetamol is an OTC product. If they insist, please note their details in the register and then inform Drugs Control Department. No Schedule H, H1, G and X drugs to be dispensed without prescription. This is to be followed not just during COVID situation, right? Even otherwise, we need to follow that. Do not engage in gossip regarding what the government is doing or not doing, number of cases in our state or the neighboring state or another country for that matter. Like we mentioned earlier, it's not going to change numbers. Do not answer any question from any patient for which you do not have information. Please tell them that you will get back, then go and refer, gather authentic information, and then convey back the same to them. In case children, elderly patients, pregnant women, or lactating mothers visit your pharmacy, please request them to stay at home as they are more prone to contract infection, and to send somebody from home on their behalf. You can even do your bit by delivering medicines to them if your schedule permits that. That way, you can even feel proud that you made some bit of contribution to the society during this pandemic. Since we should be more careful about special population, Sam will address and tell you a little more about this population with some examples. Over to you, Sam.
Yeah, let me just introduce you to all. Over to you, Sam. Yes, that's the affection that everybody has on this genial gentleman. Mr. Samson George, M.Pharm pharmacy practice with at least 15 years of actual drug counseling experience. He has written several books: Handbook of Pharma SOS, Drugs Usage in Special Population, Tobacco Free Future, Choice is Yours, and so on. He has presented many papers in the national seminars, and he is the editor for Drug Information newsletter, which is published quarterly. Welcome, welcome, sir, Mr. Sam, sir. Really great to have you. The stage is all yours.
Good afternoon, everybody. Thank you for giving me this opportunity, especially.
Please speak louder, sir. The voice is not coming through.
Good afternoon, everybody.
Yeah, louder, louder, Sam, sir.
Thank you for this opportunity you have given us, especially Group Pharmaceuticals and Subtopics and other resource people already. Sorry, somebody is Gayathri madam, Manoj Kumar, and our president, Yavagal sir. Today my task is fully just focus on the pharmacist role in special population, and I will be covering specifically a special group, that is pediatric, geriatrics, pregnancy and lactation, and also some chronic illnesses. I will not be going in more detail on scientific aspects. It will be a general talk, as you are all aware about the general situations. The current coronavirus disease pandemic is placing a huge strain on health system worldwide. And suggested solutions like social distancing and lockdowns in some areas to help reduce the spread of virus should have affected the special patient populations. As I already told, like chronic illness case, pregnancy, pediatric, geriatrics, and such type of who are unable to access the healthcare facilities for their routine care and medicine management. So here comes the actual role of a pharmacist. Whether it can be retail pharmacist or it can be a hospital pharmacist, the patient will be visiting your outlet for many health or many aspects. So here I will be just demonstrating some important roles, key points I will be covering, and for some important roles for pharmacists in this particular situation. Already Gayathri madam has explained in detail about few aspects. I will not be highlighting much on that, but I will be just going through something. Information and communication about COVID-19 is an important thing which a pharmacist should be well equipped. As already madam told, it is not just getting the information from some sources. The information what you should be having, it should be from a reliable, authentic source. And already madam has explained, like government sites and other things, I don't want to go into that. But the importance is that what information you have should be shared with your patients or the customers who is interested to know more about COVID-19. It is not to misguide them, not to mislead them, but only to upgrade or update, or they just educate them in this particular situation. So the information should be relevant and authentic, which you are going to provide to your customers or your patients. Next is community level for suspected COVID-19 cases. So this is also a very important aspect where you are going to see some patients which comes to your pharmacy with their similar symptoms of COVID-19. They may be coming to just talk to you, or maybe just coming to buy some medicine from you. Due to some suspicion, you may just ask them simple, general, as just a talk, you can just ask them how many days you are having this symptom and how long you are facing. Any of your families have or your friends have, just like that. You can just poke them to talk with you. And in case you find that they are having some symptoms which is similar to COVID-19, then it is advisable, or at least just convince them to visit or direct them to the nearest fever clinic which is available to your nearest shop, so that they will be able to screen there, and we will be doing a very good social responsibility in the community. I don't want to explain much. Again, coming into the patients with chronic diseases, I will be covering in the coming few slides. Again, chronic disease with medication availability is also very important role of pharmacists which should be taken care. Mainly, I will be highlighting on supporting rational medicine use. This is one of the major role which a pharmacist has to play in this particular situation. Other than that, promoting medication adherence, medication review and follow-up. Will not be going in details. It's only I just touch the points and I will be moving on. As already Madam has specified, rational use or rational dispensing of medicines or drugs. So this is an important criteria. As everybody knows, there is no approved specific medicines to prevent or treat COVID-19. As the social media as well as other information channels are fully flooded with claims of various potential remedies for the COVID-19 disease. Here, the community pharmacist will therefore be the most patronized health facility for the people to either seek for or verify these recommended therapies. I think you will be also hearing many therapies like now at present standard treatment, certain things which is advised by the government is hydroxychloroquine, azithromycin, some of the OTC drugs or non-prescription drugs which your patients may be asking in your chemist, like preparation of high dose of vitamin C tablets, garlic capsules, lemon tinctures, some of the apple cider vinegar. These are some of the remedies which is highlighted in most of the social media. But here comes the task for the pharmacist. Here he can provide or he can play an active role in giving an authentic information for this particular claims by promoting the rational use of medicines. I can just have shown you some example like chronic illnesses. These are some of the one group of people who are likely to be taking prescription drugs. In case due to some misguidance or misinformation, they are coming to your pharmacy and asking for some type of OTC drug. And in case you are dispensing the product, you may not be knowing the condition of that particular patient. The patient may take this medicine, and this will lead to various side effects like drug interaction with the existing medicine, or it may lead to various side effects in the particular patient. So it is very important the authentic drug information or medicinal information should be provided for the chronically ill patients whoever visits your pharmacy. Here comes the traditional role, as already Madam highlighted, you should be able to start counseling. Counseling is nothing but just talking to the patient. Simple. You just ask the questions or some probe them to answer some questions, which you will get some type of history of the patient. So that playing this traditional role, the contribution of the community pharmacist in supporting rational use of medicine during this COVID-19 pandemic will be emphasized. Next, coming into the medication adherence. This is also an important role which should be promoted by a pharmacist. As you are aware, in this particular lockdown as well as restricted movements, pharmacists can apply some type of newer technologies to remind the patients to adhere to their respective prescriptions or medicines. This can be used by your phone calls, just SMSing them or WhatsApp them, just to remind them whether you have taken the medicine, whether you have refilled the prescription, or some type of platform, social media platforms, which can be used to improvise the adherence of the patient for their particular medicines. This will improve the rapport or relationship with your patients or clients. So in the coming days, you will be recognized in the society as a pharmacist who is coming in help for all the needs in case of patients. Next is the medication review and follow. This is also a tedious task which a pharmacist has to do. Now already I think government has told you to enter some type of prescription names which patient comes under like paracetamol and some cold and cough some antitacids, etc. Now we are already started the review process. That is only the initial stage. But coming into the actual medication review and follow, as this pandemic is going to continue for some more time, the widespread of demand for physicians for consultation is a challenge. Again, the routine visit for various conditions is a challenge. Again, for minor procedures, the patient is finding difficulty to visit a hospital, or it is a risky for them to go to a hospital. In this scenario, patients will be affected and he will be able to get the prescription regularly and he should be able to take the medicines appropriately. So it is the responsibility of a pharmacist to make sure that the patient is having the regular supply of medicines whenever he is in need, as well as he is entrusted with the responsibility using their judgment to review such prescription and provide appropriate medication review management. I have given some example like opioid analysis. You may experience some people who are taking regularly or buying regularly this opioid analgesic with prescription. It may be, especially in cancer care, some type of painkillers will be prescribed. They should be continuously taking this tablet. They may be coming to you with the prescription. It is your duty to review the prescription, especially in this situation. They may not be able to go to the hospital. The doctor will come. You come after the 1 month or come after 2 months. You continue with the same prescription. In anti-anxiety medicines, antidepressive medicines, all these are some of the prescriptions which should be continued for a longer time. So in this scenario, it is very important that community pharmacists should ensure that the tolerance and the addiction should be prevented. So he should be able to review the prescription, when it was prescribed, for which patient it was prescribed, for how long it was prescribed. All this should be taken care when you dispense a medication. So in this, by this, it will be helping the patient, not only for the patient, as well as for the society. Next is the special groups, which I already told, coming to the special population, as already Madam has highlighted, the WHO, the CDC, the Indian Council of Medical Research, which is a trusted government resource which is available in India, who is giving very vital information regarding this COVID situation, and they are doing many research for bringing out vaccines, and many clinical trials are going on, and they have issued various guidelines for persons at greater risk for serious morbidity and mortality. So they are very much classified as older adults and people of any age who have serious underlying medical conditions might be at high risk for severe illness with COVID-19. So these include a list of people like above 65 years with heart conditions, diabetes, lung diseases, hypertension, cancer, etc. They have specified certain guidelines. You can visit the ICMR website. Or certain people who are dependent on nursing homes and long-term care facilities. Again, recent evidence suggests that infants and young children, that is pediatric population, may also have been in high risk in this particular cases. If you see some example like immunocompromised patients, they are very much having challenges, especially they are undergoing cancer treatment or they are going bone marrow organ transplantation, person with immune deficiencies or poorly controlled HIV or AIDS patient, or persons with taking medication that weaken the immune system. These all category of people are very much in risk. Again, diabetes is a common thing. They should be strictly adhering to their particular prescription to maintain the good glycemic control, and thereby they will be preventing the diabetic ulcers, reducing the blood pressures, etc. And this will be helping their general conditions. So if I want to just highlight some examples of drugs which is very much caution, which we should take caution when dispensing. These are some of the lists which you have to take care when you dispense to a geriatric patient, especially the elderly people. I don't want to read the list, just you can have a look. These are some of the things which leads to poor hepatic clearance or clearance from the body. So in this case, what you have to tell to your customers or the patient, it is important that tell them, keep on checking their kidney function test, is an important parameter which a patient should be knowing this particular. Again, coming into some of the drugs which I listed here, I don't want to highlight much, few things which shows a particular adverse effect in case when you are dispensing these drugs. So it is only for a watch. If you dispense these drugs, you should be able to advise the patient that this type of adverse effect may be experienced by the geriatric. Again, this is one of the special population, pregnancy and lactation. In this scenario, the virus is called novel coronavirus. Most of the people tell COVID-19, correct, but novel coronavirus. Why it is? Because with this, the novel means with no known cases before emergence of this pandemic. This virus, how it will act, most of the people doesn't know. It will act from person to person in a different way, system to system different way. Various things are involved. So in this case, especially in this vulnerable group like pregnancy, there is still studies are going, very less information whether the virus will transfer from the mother to these fetus, whether when they, if the doctors are involved in delivery, whether it will transfer. A lot of challenges are going on, still studies are going on. Again, the lactating mother, whether the virus will transfer through the milk, breastfeeding, etc. These all are some of the challenges which is faced by pregnancy and lactation. So, but as a community pharmacist, you should be able to confirm the status of patient. Either inverted comma, status of patient before this. In general, it is very important. Patient counseling is an important parameter, especially when a person comes to your pharmacy with a prescription. Kindly ensure that you just ask the basic details, whether this prescription is for yourself or for your mother or for your wife or for your kid, for your children, etc. Basic things, whether it is of the male patient, status of the patient, male patient, female patient. By this, you will be ensuring that whether the prescription is actually used by which type of patient, whether it is a pregnant patient, whether it is for a geriatric patient, etc. So status of the patient is very much important to avoid certain side effects, especially in this special population. As far as pregnant patients are concerned, you need to be aware of certain drugs which is very much proven to be teratogenic in pregnancy. These are some of the drugs which are displayed here. This is very much important when you are going to prescribe this type of group of medicines. We understand that they will be very much tense in this particular situation, especially if you come out of the house or they will be sending their caretakers or somebody else. But you can play a vital role by counseling them, not to worry. So long as they are not exposed to virus, assure them that the prevention of exposure to virus is very easy through staying indoors, maintaining distance, using face masks, etc. All these parameters and hand sanitizers, etc. and can be used soon after coming from. In case of lactating mothers, these are some of the drugs which is very much caution given there. I have just drugs, other group of corticoids, tetracycline, etc. These are very good for your information. Especially when you dispense the medication, pregnancy and lactation, there can be some guidelines for a US FDA category. If the drug falls under US FDA B or C, then it can be considered as safe. But in case if the category is D or X, then it is absolutely contraindicated or partially contraindicated. So whenever you are going to dispense the drug coming under US FDA category B or X, you should make sure that you should recheck the prescription with either with the doctor or with the relevant resources which is available with you. Here we are having a KSPC publication which gives you special information of how to use the drug in special population, pregnancy and lactation, especially geriatrics and children. You may advise them only if any of these have been prescribed by a doctor by an oversight. Coming into the conclusion, in general, humans of all ages can be infected with COVID-19. Here, pharmacists should particularly strengthen pharmaceutical care for special population, such as already I mentioned the big group. The provision of appropriate medicine information is the need of this era. And in health medicine information to be orderly, unbiased information, especially in chronic conditions, especially in special population, counseling on chronic conditions, etc. Again, addressing the polypharmacy as well as rational drug use is also an important parameter when you practice in your respective pharmacy. Promoting medication adherence, already I have discussed. Supply of essential medicines is the need of this particular hour. At the last but not least, follow up services with your patients. This is also an important thing for integral, and these are some of the important highlights which a community pharmacist or a community pharmacist should take care in this particular COVID-19 pandemic. In case you require any type of medicine information, kindly contact us, our Drug Information Center, Karnataka State Pharmacy Council, Bangalore. You can reach us through our email, kspcdhd@gmail.com, and the phone number is provided. Please contact us for any type of medicine information which be useful to pass on to your respective patients or to your customers. Thank you. Thank you. Over.
Thank you. Thank you very much. Very kind of you, Mr. Sampson. It was a very dedicated webinar speech that you have given. Very deep. It shows your concern that pharmacists should become good counselors on the right usage of medications. Now I request Mr. Manoj, young dapper Manoj, dedicated to the field of pharmacy, who is a consultant with KSPC on all technological issues. He is heralding a lot of changes there, so it's digital by choice. Over to Mr. Manoj.
Thank you, Sunil sir. Good afternoon, everyone. Good afternoon to all the attendees and all my dignitaries who are speaking with us today. My topic is tech updates for the community and the hospital pharmacist. Now, this is one of the most important times where we are adopting technology, right? And this picture probably speaks everything about it. Okay. So this is the one question which every single individual can answer. Who led the digital transformation? Is it the CEO of the company? Is the CTO of the company? Or is it COVID-19? It's COVID-19, right? Pharmacists, they are the authentic source of information and must be equipped with every positive and good information about what is happening today. They're the silent frontline COVID-19 warriors, and they're the first point of contact with patients and caretakers. Only pharmacists can do patient counseling effectively, since they are the first point of contact and they are the easiest way to reach by the caretakers and the patients. They are the one who can counsel the patients. But for doing the counseling, they must have the right knowledge, right tools, and right source of information. Now, when it comes to the right source of information, today, all of us are on the same page, thanks to Google. 98% of the users today are on Google. And what I have access to, probably you also have access to if you know how to search. Then too, you need to know how to classify the information from the Google and also how to get the authentic information from Google. It is not that easy. So in times of COVID-19, lot of false news are also circulating, and that is how we need to take care and ensure that all of us are equipped with the right tools and information. Now, resources for India and the global. We all of us are using WhatsApp, Telegram, and Government of India has initiated a WhatsApp bot. WhatsApp bot is something which will give you automated information throughout 24/7 as and when the things are updated. Telegram is another channel which is released by the Government of India, which gives you updated information, and it has more than 97 lakhs users currently. And it gives 24/7 updates of information with respect to COVID-19. And there is another app called Arogya Setu, which about 9.4 crore Indian population is using today, and I'll give you more details about in my next slide. Now, as far as global audience are concerned, the best source of information directly from WHO is through this WhatsApp number. It's a chatbot, through WhatsApp, which releases every single information globally with respect to COVID-19. All the updates related to COVID-19 are released on this WhatsApp number. Arogya Setu has been released by Government of India, and it is available in 11 different languages. And the advantage of this particular app is it is one of the best source of information for you, and it is kind of personalized bodyguard for you. It helps you to stay connected to the entire population which is on this app, about 9.4 crores individuals currently, and helps you to identify the users who are positive, COVID positive in your area. So there is an option which can help you to find out if the nearest COVID positive user is 500 meters away from you, 2 kilometers away from you, 1 kilometer away from you, how many users have taken tests on COVID-19, and how many users have tested positive, which is the nearest information center, what the helpline numbers, and every single information related to COVID-19 is available on this app. The beauty is it is available in different languages, regional languages, so language is not a problem. And you must advise your patients. As pharmacist, you should first of all install this app, update it, and secondly, you must promote this app to your patients and ask them to install. And once your Bluetooth is on, the moment some positive patient comes to even close to you, it gives an alert to you. See, that is the advantage, right? So it gives you an updated information if somebody near to you is COVID positive, and immediately you can take necessary actions, right? Precautionary measures also. Now, other information sources from India are, the Ministry of Health and Family Welfare. They have an updated information site with respect to COVID-19. And the mygov.in also gives you a lot of videos, the pamphlets and other information sources with respect to COVID-19. For the global, if you want to know the global status of COVID-19, the best source of information is WHO and the Centers for Disease Control and Prevention, cdc.gov. The another information center is fip.org, and India there is another one is through other pharmaceutical associations. Some councils are also giving a positive information and updated information about COVID-19. Now there is another fact sheet which is developed by Harvard Health Publication in association with various associations, organizations, and institutions. And it is these fact sheets are available in 30 different languages. All these fact sheets can be downloaded from this particular link, which I have updated here. Thank you so much. If you have any specific discussions you want to discuss with me, you can please connect with me at this on Twitter, and also send an email to me. And over to Sunil sir now. Thank you.
Thank you very much, Manoj. That was short and sweet. As usual, you gave very, very good information in the shortest period of time. That Arogya point which you emphasized, it is a lifesaver for the community and hospital pharmacists. Thank you very much. Today we have on this webinar, we are honored to have the most dynamic, enlightened leadership which Mr. Sunil Attaur provides as the president of KDPMA. He will provide us with very special remarks, including with what the industry is doing and how we should rise up as pharmacists to this COVID-19 situation and many other points. Mr. Sunil Attaur, sir, we are all ears. Please, the stage is yours.
Thank you, Sunil, and thank you to the Karnataka State Pharmacy Council for conducting this wonderful program on the importance of knowledge updation. I won't talk about the current situation and COVID, because I think Dr. Gayathri and Manoj and Sam has done an excellent job in highlighting the issues and how the community pharmacists have to kind of step up. Actually, they already have done that in this crisis situation. I'm going to talk a little beyond that because in a crisis we all come together, and I don't think before Corona we would have had such a big audience, and we listened to a lot. But like a magic trick, what happens is the magician, or when something is happening, he will do something else, and there will be some more things, regulations that will come about, and we will be caught unawares. And the same thing has happened, is happening now, which is of great importance to the pharmacist community. In the last 2 weeks, there have been two very big news items. I don't know whether it has you would have seen it or you would have missed it, but which have very serious consequences. One is the possible takeover of NetMeds by Reliance. It was a big news item. Now, I'm sure you know that Facebook has made a big investment in Reliance, and WhatsApp is owned by Facebook. Now, when you have WhatsApp, Facebook, and Reliance, it's a very lethal combination. It will change the entire, pharmaceutical distribution system in our country. And this is something that the entire industry and the community has to keep your eyes open to, and we have to start preparing and understanding as to what we have to do next. The second was when last week our Honorable Prime Minister made a statement that our drug regulatory system is creaky and cumbersome, and he has called for a big change in the drug regulatory system. Now, coming from the Prime Minister, and I'm sure there will be immediate reactions and what you call actions that will be taken by the officers in the health ministry as well as in other areas to bring about and upgrade the regulatory system. And you would possibly see a lot of change which would include implementation of good distribution practices. Now, this will also have another impact on the entire pharmaceutical supply chain, the manufacturing, research and development. So I think we need to the community pharmacist, of course, it's not that we have to get afraid and start, wondering what the future is going to be, because we believe that the role of the pharmacist is going to go up multifold. Because with all the way people are today and with the social distancing guidelines, and it's not going to be there, where 100 patients walk into a dental clinic or a doctor's clinic and he sees patients. It is going to be very structured. There will be a lot of appointments taken. There will be the number of patients a doctor will see per day will be limited. So what will happen is that the role of the pharmacist is going to go up. And this, what you call, definitely means that every pharmacist, these sessions on knowledge updation, these sessions on, equipping ourselves is something that we have to do on a more regular basis. I think I have been calling this Corona the WhatsApp moment for what WhatsApp did to digital messaging. Corona has done to online, communication. And I think we should use this opportunity that is what has happened to actually continue to update ourselves. It's very critical. They will be continuously engage. As a webinar, of course, this is more one way, but you have other forums like Zoom or WebEx or other tools where the council, especially the council which are managing such a large team, is in interaction with the pharmacists across the state, across the company, to actually keep updating, keep getting ourselves educated. There should be more interactions between industry and the community pharmacists, because whatever changes are going to come are definitely going to affect all of us. The industry, of course, is also looking at the entire supply chain scenario, because we faced a lot of challenges in the first 15-20 days of this virus and in terms of supplies. But I must say that what has happened is that in the last 45 days, the government of India, not only the image of the entire industry, the entire the pharmacist community has gone up multifold. They have realized that even though everything was shut, even though there was no movement, but there was no incident where a patient was left without medicines, or a patient had to be gone back, or nobody has got any sick seriously, because the entire full chain, right from the chemist to the stockist to the distributors to the companies, actually stood up. So the image of the pharmacy community has gone up. Now it is left to associations like KSPC or others to actually encash on this, and make people more aware about the great importance that the pharmacist plays in the entire healthcare chain. The doctors only diagnose; everything else is done by a pharmacist. So I think this is an opportunity that the pharmacist should encash. At the same time, even with the patients also have realized that when no doctors were there and they were sick, they had to run to the pharmacist who helped them. So we have to use this what you call opportunity in A, to continuously educate and update ourselves, and B, encash on the great goodwill that that this virus has actually, as a positive side effect to the community, has brought to us, and we have to encash on this and take this forward. So thank you very much.
Oh, what a fantastic set of observations, Sunil Attawar, sir. Thank you very much. It was so enlightening and empowering. Truly, the points made by you will engage us, and KSPC will definitely take a note of it. Do you have anything to say, Yavagal, sir, in response to what Mr. Sunil Attawar, sir, said? Because he made some very good points.
Yeah, it is really, waken us in a very strong way. So, no, all these days, the pharmacist has become only a trader. Now he has made awareness, a pharmacist, not a trader, he is also a, what you call, a
Counselor.
pardon?
Counselor.
Not counselor, he is also professionalist like others, like a doctor, engineer, other people. He's like he's also part of healthcare. So he has put a lot of responsibility on us pharmacists, and we are ready to take the responsibility and see that the national healthcare is taken very unanimously and perfectly, and it is our own duty. A pharmacist is a businessman, a manufacturer, and he is finding up new drugs. He is moving all the way. A pharmacist can do anything to the human community. I think he has awakened us, and we will take it in the right pleasure. Thank you, sir. Thank you, Mr. Attawar.
Thank you.
Thank you very much, sir. And actually, we come to the QA session. This is not going to be big. I just have one question each. One is for Dr. Gayathri, madam. So please, ma'am, because these are the things we get on the chat box, etc. So can you shed some light on the development of vaccines? That is one question. So I think you can take that. Gayathri, madam. Please put the audio on. No, audio is not clear.
Yeah. Not hearing it all.
Dr. Gayathri, madam, audio should be on. Yeah, please speak. No, we are not getting any voice. Okay, I'll come back to you. I'll field one question to Samson, sir. And this question is regarding the banned list of drugs. So is there any, provision for the pharmacist to come to know about the banned list of drugs? Samson, sir.
Obviously, sir.
Pardon?
Hello. Yeah. Obviously, the banned list is available in our State Pharmacy Council. In case, if they want the banned list, if they can share their email ID, I'll be able to send them a list of banned drugs in India across to their email. Or in case if they are going to take our publication, in all the publications, we have given a detailed list of banned drugs in India.
Okay. Thank you. Can we come back to Gayathri, madam? Is your audio okay now? No, it's not clear. There's no voice.
No, not clearly.
No voice.
Sound.
No voice, ma'am.
Yes.
Actually, there was a research oriented. No, ma'am, it's not clear. Hello? Hello? No. Samson, sir, can you take that question regarding vaccine status, please? Somebody is asking. Samson, sir?
Hello. Yeah.
Yeah, vaccines.
At present, actually, there are many countries trying for developing vaccines. Even India also is in the phase of various clinical studies going on. And I think most of them should have watched recently. Italy has claimed to develop the first COVID vaccine that almost yesterday or something, the news has come. And the development is still going on, as everybody is knowing. But when exactly the vaccine will come into the market is still a question mark, because the clinical trials are going on. Phase 1 has gone, is finished. Phase 2 is almost completed, it seems. But again, the question remains same. like when it is exactly available in the counter. It may take 6 months, some people are telling 6 months, but it is not very sure about that. But we have to wait and watch. But surely it will be coming as soon as possible, because many countries have taken initiative for this particular thing, and even WHO also is monitoring the development of this vaccine development in all the countries.
Okay, Gayathri madam, are you there? Can you speak now? Hello? No, I think there is some problem. Hello?
No, I think it's a muted anyway.
Okay, I think we'll call it a day. We have exceeded our time. And I will say thank you thrice, because it was such an excellent webinar. The participation was lovely. And I thank Yavagal sir. You brought that garima, you brought that great dignified presence to the entire proceedings. Opening remarks really were very well taken. And Gayathri madam, you are lovely. I always say you are both photogenic and photonic, because you are so energetic. And thank you very much. Your talk was also very good, inspiring to the young kids. In fact, there was one kid who has asked, or one community pharmacist student who has asked, can you use the bat as an immune system model? Look at that. I like that question. I thought you should have commented on that. So, Samson sir, you are also very, very enlightening to us, particularly on the do's and don'ts on a day-to-day basis, which the pharmacists have to do. So I think they should be in touch with you. The drug information service which you are doing is a great, useful thing. And Manoj, you are very short and very sweet of you, and that Arogya Setu point has been well taken by everybody. Sunilata sir, thank you very much. Your insights have provoked a lot of thinking, and as usual, it was an enlightening leadership. Thank you, one and all, and have a nice time till we meet again. This is the webinar from the pharmacist, by the pharmacist, of the pharmacist. Thank you very much.